Hi, everyone. It's lovely to be back at Smith, although a little mind-bending, I have to admit. Thank you so much for those incredibly depressing remarks.
You're glad. I'm glad
yeah, I really appreciate that a lot. Yeah. Yeah, that was great. So I want to talk a bit about kind of two things. One is my journey in this work. And I feel like I'd be remiss if I didn't sort of mention that I feel like part of my training when I was at Smith under the guidance of people like the amazing Susan Van Dyne and Marilyn Schuster and others here on campus was about women's stories and how important women's stories are. And mine is really important. But I want to sort of talk to you about, so how did I come to where I am in thinking about the world and thinking about women and sexual health, which is really sort of how I spend my day. And then I want to talk a bit about sort of what I see happening in the media right now and what I see happening with, in particular, what we're kind of selling to young women these days in terms of what their options are and who they can be when they grow up and sort of how they're supposed to manage their reproductive health, their sexual health, and their bikini tops. So, and then I'm going to end with a couple of book recommendations because I've just been thinking, just actually as Candace was speaking about, all these things that I would recommend that you take a look at in your copious spare time. Okay. So after I left Smith, I went to Boston and worked in a battered women's shelter. And I had done some volunteer work when I was here in Northampton at a battered women's organization that was at the time called Necesidades, which I think now is called Safe Passages. Is that right? Yeah. So I was trained there, and I did volunteer work with them and got really interested in this issue of domestic violence and sort of thinking about how we help women. And that was, if I was able to wear a name tag, that would have been like what it said when I left here. I'm going to help women, right? So I moved to Boston and I start working in this battered women's program. And, it was amazing, like mind-blowing and just unbelievable, the stories that women came into our shelter with. And we were an unusual shelter in that we had one room that had 4 beds. And so what that meant was that women with larger families could come and stay with us. So we would have women with, 4, 5, 6 children come and stay in the shelter. And they would talk about sort of what happened to them and their most common denominator, which is sort of interesting because it's not really what they tell you when you start working with battered women, is that they were all incredibly poor. And so what that sort of pointed out was that if you had any other option, right? Like if you had a sister who had a spare bedroom, or you could pay for a hotel, or you could take a trip and go visit your mom for a little while, you did not end up in our shelter, right? But if you had no other option, no resources, no credit card you could max out, that's where you ended up, was in this, kind of smelly, not very pleasant, shelter where you might be living next door to a woman who had raging substance abuse problems or, other sorts of issues. So I discovered pretty quickly that I actually really suck at working directly with people one-on-one. Just have no skill for it whatsoever. And there was a lot of crying, a lot of over-identification, and sort of opening my wallet and being like, well, just, here you go. So yeah, you're not really supposed to do that when you do direct service. So it became really clear that I should get out of this field quickly. And what I realized too was that we could fix one woman's life momentarily. We could literally help her heal from whatever horrendous atrocities had been enforced on her body or on her children's bodies. We could give her a quiet place to sleep. We could try to figure out her housing situation. We could do all these things in the moment. But there were 10 women behind her, right? And 10 women behind those 10 women, and another 10 behind those 10 women. And I felt like I have to back up. I have to figure out how I can get further upstream so that we can like cut this line down a little bit, right? Like so that the women who end up in this situation, in this desperate, painful, horrible place, like how do we try to stop that from happening instead of just like literally mopping up tears and putting people back together, right? Who are broken. And in particular, again, like with my lack of talent in that area, I needed to move. So I started doing training, and I started doing work with providers mostly, so people who work with people around sexual health and around sexuality education. And I sort of wound my way from AIDS Action to Planned Parenthood to really thinking about how do we train and teach young people about some of the really basic things about, you know, what does it mean to be in a relationship? What does it mean to, you know, be in an equal partnership? What does sexuality really mean? What does it mean for you? What does it mean for you and your partner? What does it mean for your family? And through that work in sexuality education, discovered public health. And then I was like, oh, I sort of figured it out. Like, public health was the place where, you know, we're most deeply engaged in thinking about how to try to solve problems before they happen. And in particular, have this constant vision of solving problems or working with communities, empowering communities to help solve their own problems and to look at root causes. So all the time thinking, what's underneath this? Yes, we have enormous health disparities like Candace referenced, absolutely. But what's underneath that, right? What are the conditions in which we are setting people up that they are, again, ending up in disparate sort of buckets of health issues? So I worked at the state health department after I got my master's degree, and I discovered sort of delightfully that teen pregnancy was really actually the place where, and you're going to hear from Jessica, I think she had a similar moment where it was like, oh, right, so this is where it all comes together, right? This is where disparity and poverty and sexual health and lack of sex education and lack of access to reproductive care, this is where it all collides, right, is in teen pregnancy. And I started doing a lot of work around abstinence-only education and around the problem with the way that our sexual health is currently organized and set up and disseminated in this country. So if you're not clear on this yet, let me be the first to inform you that our sexual health and sexuality education system in this country, I forgot to ask if we were allowed to be profane, so I'm just, okay. Some of my students charge me like 50 cents for each F-bomb that I drop, and like at the end of class I get like a little slip that's like, you owe $10. Yeah. So it's fucked, right? It's totally fucked. It's completely insane the way we do sexuality education in this country. And frankly, in my opinion, it is the root of a lot of our problems. So the way that we educate or don't educate young people about their bodies and about what to do with those bodies and what to do with those overwhelming feelings that happen in their bodies, to me, it's like we're building this road directly to the Battered Women's Program, right? And in particular, we're doing that for our most vulnerable young people. Because sexuality education, it's completely, your destiny is geography. So if you grow up in an affluent community that has liberal underpinnings or sort of good, social values in terms of like, we're in the collective good, we're in a neighborhood where we all sort of feel like what happens to you matters to me and that kind of thing, you are likely to receive, at least on the baseline, pretty decent sex ed. If you grow up in a crappy area of Boston, you might get decent sexuality education, and you might get the free abstinence-only program that the Women's Pregnancy Crisis Center is offering for free to the high school, right? And in that program, basically what you're going to be taught is that sex is completely disgusting. It's vile, right? It's gross, and it's particularly gross for girls because we don't really want it anyways. And you should save this gross, vile, disgusting thing for the person that you love the most. Well, that's how we want to do it. And, you know, and at the same time, at the exact same time, what we sell to girls and women is that our most powerful leaders, right, our most powerful women figures are just waiting to be knocked off their pedestal. Like, that's what we want to do in this country. So I'm going to throw out a couple of names. So Lindsay Lohan, Britney Spears, Miley Cyrus, like all three of those young women follow this very common trajectory, right? They start out as like these perfect girls. You know, they're the princesses. They're literally like the Disney princesses. They're caricatures on the Disney Channel, right? Or Nickelodeon, I think. And then they hit puberty, and all of a sudden, they're like girls gone bad, right? And we love this. American culture like just devours this wholesale. And then we try to take as many pictures of them falling off this pedestal as we possibly can, right? So, you know, watching Lindsay Lohan go from like the little Mickey ears, right, to like, you know, falling over drunk in Manhattan, or I think her drug of choice is mostly cocaine. But anyways, you know, it's this like, so that's what we're telling girls. So here you go, right? Here's your perfect pathway. And by the way, we're not going to tell you anything about your sexuality or about pleasure or about how to control your own body or how your body works. And if you have any, you know, doubt about this, if I sound too strident or, you know, like crazy or whatever, it's hard to sound strident at Smith, but if I'm achieving that, if I'm hitting that nail on the head, look at Halloween costumes. Oh, you know, right now, I give this like, you know, public service announcement to my students on the Friday before whatever weekend is falling before Halloween. And, you know, I will say, like, be ye not stupid, right? Like, don't take pictures of yourself dressed as, like, the milkmaid and put them on Facebook because you're not going to get into law school, right? Like, that kind of stuff comes up later in life. But it's not the individual fault of that smart, beautiful, awesome BU student who's in my public health class that that's what she thinks she should be for Halloween, right? Like, she didn't just come up with that, you know? And it's our screwed up world that has made it so that for girls and women to celebrate their sexuality is completely commercialized, right? So I could go on for like 6 more hours. How much longer would you?
You have a couple more minutes.
A couple more minutes? Okay. So I want to just talk about sort of one other thing, which is that I've had this wonderful opportunity to work with a sexuality educator from Pennsylvania, who some of you may have heard about, Al Vernacchio. He was on the cover of the New York Times Magazine last November. He's a remarkable human being. He did a TED Talk. You're all familiar with TED Talks? Are you addicted to TED Talks? Okay, good. Good. So Al talks about sexuality and sex ed for young people as justice, right? And as like, you know, that's something that we owe to young people. And he talks about it as like, we have the right to know how our bodies work, and we have the right to know how they feel, and we have the right to not be ashamed of that. And that leads to all these other good outcomes, right? Because then you don't feel like it's okay for somebody to make you feel bad about yourself or put pressure on you, because that's yours. You own that, right? You own that sexuality. And so Al tells this story about an exercise that he does with his high school students, which I have done actually with college students to remarkably much the same outcome, despite their 5-year age difference, which is that Al talks about saying to his class, so I'll say to all of you, right? So you're here in Sealy, and you're you're at this panel, and you're having a great morning. You heard this awesome speaker, and then you get up and you get all your crap and you grab your iPhone and such, and you head out the door, and you get out downstairs and you're heading back to your house, and oh crap, you look down and you realize, I forgot my genitals. I left them upstairs in the hall, right? No big deal. So, you turn around and you head back up. And so you get back up here and you know, you're walking around and you run into Carrie and you're like, oh, Carrie, I forgot my genitals when I was here earlier. And she's like, oh, no problem. You know, that's the room for lost genitals is just down the hall, right? So you head down the hall and there it is, one of these nice Smith rooms that's all set up, right? And you go in and there's the administrator for lost genitals and they're standing there waiting for you and you walk up to them and you say, I lost my genitals. And they're like, oh, okay, you know, which parts do you need? Do you need the female parts or the male parts? And you say female parts. And so you walk over and there's all these vulvas, right, lined up on the shelf, okay? And you don't know which one's yours. Like, you couldn't pick it out. The boys walk in to the boys' area of lost genitals, and they're like, come to Papa, right? Like, it leaps out from the shelf, and they embrace it with their arms, right? Because now part of it, like, let's be clear, part of it's just like anatomy, right? Like, we're inside, they're outside, right? So they get to look a little more than we do. But we have what Al calls this penis arrogance, right? That boys, young boys and men are taught, you know, as part of hygiene, as part of learning how to pee. I have a 9-year-old, so boy. So, you know, I'm familiar with this. Like, they know what it looks like. They know how it works. You know, they touch it all the time. Girls don't do that. And they don't have that familiarity. So how can we expect them to have conversations with their lovers about what they want or what they don't want? If they have no idea, they think it's kind of gross, they don't really want to look, they don't really want to go get GYN care because they don't really want to have to do that, right? We've created regular health care, like going and getting a gynecological exam is somehow like this horrible thing, right? Like, we have to now promote to girls and women that, you know, actually they don't wrench your legs apart like you're a wishbone, right? Like, we've somehow created this image that it's so terrible. And again, I think that has consequences. I think that has huge consequences. So if you don't know what your normal, healthy vulva is supposed to look like, and I just have to pause here for a moment and say that, like, this is my fantasy coming true. I'm sitting at Smith College talking about vulvas. Like, I can die happy. Like, it's okay if I don't make it home today. Like, I'm done. Like, it's pretty awesome. Yeah. So yeah, if people don't know what healthy vulvas are like, how are they ever going to figure it out if it's not working correctly? And most sexually transmitted infections, the ones that are most common among young women, the young women I think about and take care of, don't have symptoms anyways. Despite the lies that you've been told in your high school terrible sex ed classes that, you know, you're going to get these raging symptoms that are like a neon light, right? So last but not least, I want to just end, like I promised, by just talking about a few books I would recommend, just for fun. So I don't know how much talk on campus there's been about Piper Kerman. So Piper's a Smithy. She was 91, I think. And she has written a prison memoir about her experience in prison called Orange is the New Black. And she uses it as a way to really echo much of what you said about the horrible conditions in which women are incarcerated. And Piper, as she admits, was in actually a really sort of swanky, if you can call it that, facility. So Orange is the New Black by Piper Kerman. The other one I would really recommend if you all haven't seen it is The Immortal Life of Henrietta Lacks. Have people read that? So again, talk about an intersection of violence and reproductive justice and autonomy over ourselves. And then, just in time for Halloween, I would recommend Cinderella Ate My Daughter by Peggy Ornstein, who talks a lot about, again, this marketing that's done to girls and sort of what we think women and girls can be.